Hello, Professor and class. My name is Andrea Underwood. Going to do a quick review of my paper or my projected project. The title of my project will be Self-Care Deficits Among Nurses and Its Effects on Patient Care. I'm a little sick, so just bear with me. Going to get through it and try to explain it as clearly as possible so that you can understand. So we're going to start. We're going to start with the background. Self-care is an extremely important factor in life that contributes to morals, lifestyles, health, longevity, and beliefs. It serves as a mandatory concept for sustainable career, general well-being, and ethical principles to avoid impairment and harm to the public. Nursing can be one of the most stressful and demanding professions. Engaging and creating a healthy lifestyle with positive self-care can consist of healthy eating habits, exercising, relaxation, reading, baths, decompressing after a hard shift, and breathing techniques. So many more factors that contribute to self-care as well. The main question that I'm trying to investigate is, does the self-care deficits of nurses have effect on patient care in the hospital setting? So we want to examine in this project whether nurses provide adequate self-care to themselves when taking care of patients. When they don't provide adequate self-care, for one, we want to determine, are they able to? Do they possibly have the knowledge? And what effects does it have on patient care? So with this, in this semester, we I completed a literature review where I used Galileo and looked up about 10 to 15 articles that pertains to self-care. I picked out a couple for this particular assignment, and the first one that I chose was the title was The Self-Care Strategies to Combat Burnout Among Pediatric Critical Care Nurses and Physicians. It had multiple authors, so I included those in the list below. In this article, we and the other authors designed a qualitative descriptive study to determine the perception of self-care strategies to fight professional burnout among nurses and physicians in the acute care hospital setting. Burnout will be a factor of not properly providing self-care. Results determined that there were 6 self-care strategies were found, and they were finding meaning in work, connecting with the energy source, nurturing interpersonal connections, developing an attitude of positivity, performing emotional hygiene, and recognizing one's own uniqueness and contributions to work. Those are things that could be done in order to prevent burnout, and those are considered to be some of the self-care practices that could be used by nurses and physicians. The study concluded that effective self-care strategies processes and helps promote psychological well-being and reduces burnout overall. In this study, it basically examines self-care overall, and it explains certain aspects of self-care that could help promote a healthy mental well-being, physical well-being, and promote positive patient care. The next article in the review of literature I found to be interesting and could be a contributing aspect to my project is a systemic review of self-care measures for professionals and trainees. This article also had multiple um, authors in which I listed below. This article was also a peer-reviewed article found on Galileo as well. They provided a systematic review um, that pertains to a lack of self-care in the health service profession and has been considered a cause of compromised quality of care and services and contributes to burnout as well. A lot of the self-care articles reference back to burnout, meaning that not providing yourself with self-care as a nurse could lead to burnout. The most important aim of this particular study is to review the self-care measures designed for and applied in professional settings by summarizing the key parameters of measurement and synthesizing all of those things and trends to a professional self-care research. The literature review for this particular article was conducted, and it was determined that the professional self-care research is in its infancy and continuous development of professional self-care at both the conceptual level and empirical level is needed. When doing this research, I found that it was not a whole lot of studies about self-care. It was more so a lot of things that could be done to promote self-care in the nursing field. I found a couple of studies that gave some inspirations to self-care. I found some self-created items that allow nurses to provide self-care. I found studies that piloted programs that'll promote self-care as well. All of those will be listed in my literature review in the articles that were looked up. It's a list of 10, and we'll be able to go over those at a later time. The general design of my study is an exploratory descriptive study that will address an issue or problem in need of a solution or further understanding. The study will seek information about self-care among nurses and determine basically if it affects the quality of care that's going to be provided to the patient. The measurement tool that I will use is the Health Promoting Lifestyle Profile tool. The survey tool is used to measure the extent in which adults participate in health promoting lifestyles. The Health Promoting Lifestyle measurement tool is composed of multiple aspects, including health promotion behaviors, lifestyle, including health responsibility, physical activity, nutrition, spiritual growth, interpersonal relationships, and stress management. The survey answer choices are never, sometimes, often, routinely, with a scoring of 1 to 4. If you click on the link in the PowerPoint, you'll be able to see where it's a list of questions, and then the participant will be able to answer the questions 1 through 4, ranging 1 at the lowest end, 4 at the greatest end, and then a tally at the end with the average of what the score will be. The score at the end will determine if the participant either on the lower end does not participate in a lot of self-care measures, on the higher end is basically promotes and basically participates in a high level of self-care and provides optimal care to patients. With the participants, a consent will be given out. With the facility that the survey will be provided in, a questionnaire will be sent to gain approval in order to actually conduct the study. A random selection of nurses will be taken in the study. It'll be by participation only. The nurses will have the discretion of whether they want to participate or not. The age has to be 21 and older. Years of experience will be considered. Race and ethnicity will be included as well, because that can kind of guide me into learning or knowing whether the participant has learned self-care or was taught self-care, or morals and traditions could also be a contributing factor as well. So we will take all those demographics into consideration when a participant participates in the study. In conclusion, the overall project will determine whether self-care measures has an effect on patient care, examining the factors like burnout, overwork, measures for being overworked, not eating properly, stressful activities. All of the contributing factors will be considered in compiling the literature review, and what was found in the study will gain the results and the conclusion for the study. This concludes the end of my PowerPoint. Are there any questions or comments? Can be emailed or sent. I would like to thank you for your time. And if it's any contributing factors that you would like to send, that will be great and useful as well. I'd like to thank you again and have a great night. Below is a list of references used for this particular PowerPoint. All articles were found on Galileo, the Galileo system that is listed in the core shell.